Arthritis is not just a disease affecting old people. 24,000 Canadian kids and teens are living with arthritis. So for Juvenile Arthritis Month, health specialist Leah Sarich introducing us now to a teenager with arthritis who's learning to manage the disease.
Yeah, and that's a big part of it because, of course, these teenagers grow up and they've got a chronic illness, so this illness isn't going anywhere. So arthritis is one of the most common causes of chronic disability in children. It can mean they can't carry a backpack or play the sports that they love, and the reason is because they're in a lot of pain and their joints are swollen.
Carrying a simple thing like a backpack. I didn't even think of that.
We take it for granted, right? But that could really be painful for these kids. They've got swollen joints, they've got stiff joints, it hurts all the time. But if it's diagnosed early and treated well, the disease can be managed to the point now where these kids can actually return to a normal life. So I met Jared. He is 17 years old. That's him there. He was diagnosed back when he was 11. And he said, you know, he told me, he said, I was angry all of the time back then because his fingers were so stiff and he just couldn't do what he wanted to do. He wanted to play with his Legos. He wanted to play basketball. Couldn't do these things because he was in so much pain. Wow. But Jared does tell me that he's much happier now because his arthritis is pretty well under control. But that's because he takes several medications every day. He even has to have one medication delivered as an injection once a week. Wow. But Jared turns 18 next month. So he's learning how to manage his illness himself so he can make the transition into adult care. His doctor says it's a really tricky time for patients. You know, they're nervous about their new doctor, they're nervous about going to a new hospital. Really, it's a challenging time for everyone.
For the pediatric person, it's can I communicate what they need to know to the new doctor in a very concise way, but not leave out the details. For the adult doctor, it's do I know everything that I need to know about this patient quickly so that I can provide care immediately. For the parents, it's can I let go? Does my kid know their disease well enough? Do we need to be there to make treatment decisions, or can my child handle those decisions on their own? So teaching parents to let go, but do it in a very supportive way, can be challenging and can take years.
For sure.
To let go, that would be tough.
That would be really tough because you want to make sure your kid's okay. But you can't do this after the age of 18, right? They have to do it on their own. Which is why Jared has been working on this with his team of people, his family, his doctor, for a good long time now. And he's learning about his medications. He's learning what they're called and what they do and what they're not supposed to do. He's learning even how to articulate his symptoms and pay attention to how long has this pain been happening, what does it feel like, that kind of thing. He has to be able to articulate that to his new doctor. So he's learning to talk about what he needs. He's even giving himself his own injection now.
Good for him.
Yeah, good for him. And he told me, he said, I was really afraid of needles. So this was a big, big move for him. But he's been able to manage his arthritis quite well. And these days, he tells me, he has more good days than bad.
I'm feeling good. There's some days that I am sore and I notice it more than other days. But I'm still able to play volleyball. I was captain of my senior boys team this year. I longboard with my buddies all the time. I go skiing every weekend, so I'm still fairly active.
So that sounds pretty good,
longboarding,
hey?
volleyball?
Captain of the volleyball team.
Good for Jared.
Yeah, he's pretty active still. So, of course, he doesn't want to lose this ability, right? So that can be quite motivating when he transitions into the adult healthcare system. But he is going to have a lot of distractions. So think about this. He graduates this year. He's got a girlfriend. He does lots of sports. Next year, he's going to be upgrading. He's going to be working full-time. So there's going to be a lot of things that are going to be pulling for his attention. And some of that attention needs to go towards managing his illness, of course. And we have to remember that juvenile arthritis is a chronic illness. It's not going away. There's no cure. And as he gets older, there's a very good chance that disease is going to change as he changes. Yeah. So it's a process for sure, but he's certainly on his way with lots of support.
Good for Jared. And anyone who wants to kind of redigest this, it's going to be on your blog.
Oh, on my blog, you bet.
And of course, the videos on our website as well will be posted sometime later on today. Breakfast